Hello, everybody. My name is Jessica Davis, and I'm the Marketing and Communications Manager for Fear Free. Thank you for joining us for proactive practices for preventing and alleviating fear, anxiety, stress, and pain in times of COVID-19, where Dr. Tamara Grubb, Fear Free Certified Anesthesiologist, and Dr. Gary Landsberg, Fear Free Certified Behaviorist and Head of Fear Free Research, will be discussing the maintenance of fear free protocols, including guidelines for the use and selection of medications at a time when the COVID-19 virus is necessitating social distancing and limitation of services, which can lead to the need for pre-entry assessment and separating owners from their pets for veterinary care. If you have any questions during the webinar, please be sure to enter them in the Q&A box. We will have a brief Q&A session at the end of the presentation. We're so excited to have Dr. Grubb and Dr. Landsberg here with us today. So on that note, Dr. Grubb and Dr. Landsberg, take it away.
Hello. I'm going to start off and welcome everybody to the seminar. It's Dr. Landsberg. Dr. Grubb is the female voice that you'll be hearing shortly.
Hello, everybody.
Yeah, there you go.
Sorry, my microphone wasn't working, so I had to butt in just to show that now it's working.
Great. Nice to see you. Tammy and I just spoke at the VMX conference in person together, and somewhat surprising. Glad we could join each other in another conference, even though we're on different coasts and in different countries, but very unfortunate under the circumstances that that we have to bring this to you. But hopefully we'll have some important information and help you practice fear-free in times of COVID, with the focus on our two specialties, behavior and anesthesia and analgesia. So the objectives and overview, thought we'd put them together, is for pre-visit, and that's even before the appointment is on your doorsteps. So pre-visit from home, assessment and planning for what might be essential veterinary care or emergency veterinary care. And I know that is defined differently in certain localities, certain municipalities, certain states, depending on the level of COVID and seriousness of disease at the current time. We're going to talk about the need for and importance of using the emotional record, the medical record, the history, and probably professional, either veterinary or technician screening when that appointment is being booked to make sure it does meet the requirements for essential and emergency services, which requires some veterinary screening. It's a little different than everyday practice where we want them to make an appointment and come in and then we'll assess the pet. Now we want the veterinarian to be involved or the healthcare team to be involved in deciding whether it is an essential or emergency services and in the pre-planning. Also consider the risk in that household and their health and whether they're in quarantine or isolation in booking that appointment. We'll also talk about the continued use of pre-visit products and medications. And you'll see that a lot of what we're doing is fear-free principles in COVID times with only minor adjustments. But when it comes to assessment procedures, we want to use, we want to use fear-free principles, beginning with non-contact social distancing where we can, and how we manage essential contact. We'll talk about telemedicine, provided your regulatory bodies accept that and you have a proper veterinary client-patient relationship. Of course, you can do that with your existing clients and in most cases now with clients, versus in-person outdoor assessment where it might be done in the car or it might be done at sufficient social distance. We'll talk about what you can learn from visual observation and specific to fear-free pain and fear, anxiety, and stress assessment before you even go to that pet or admit that pet, and the potential need for additional PVPs, pre-visit pharmaceuticals, even if you've used them prior to the travel. And then the special considerations for separating the pet from the owner and the distress that might cause when you're handling and admitting to the hospital. So that's an overview of what we're going to talk about. Also some content already, and we'll get into it now. So one slide with quite a few words. Just to remind you that when you're planning and scheduling, it's based on the pet's needs, on the owner's needs and the health of that owner, on the limitations and what can be provided in the clinic, and on the problems themselves. And if you're limiting to essential or emergency services, then that's why I mentioned the veterinary screening involvement, to see that it does fall into a category of pain or suffering, illness that might progress, issues related to human health, and with the essential but not emergency services, the needed preventive care, such as vaccines that might be zoonotic potential if the pet doesn't receive them, or boosters in a series of vaccines where the next booster is due. I think all of these decisions are made in part with your local municipality and state and regional requirements for shelter in place or for restrictions, and in part by the clinic. Do you have the supplies, the staffing, the physical ability to social distance and prevent walk-ins? Or are you unable to provide services because you just cannot physically and staff-wise provide those services, in which case referral to the appropriate emergency facility, but staying available to provide history. The owner screening, are the owners in quarantine? Do they have a low-risk household? Do they have a family member who is low risk, who can bring the pet? Because that's going to be essential to maintain staff health and safety. Telemedicine is at the top of the list if the veterinary client-patient relationship is established, or it's been waived or not necessary in your municipality, and whenever physical presence is not essential. On arrival, you want them to wait at a social distance if they've walked over, to wait in their vehicle, and to use telecommunication to know that they've arrived and schedule and plan and keep separation properly. Outdoors, you could observe the pet in the car, in a crate in the back of the vehicle, such as people that might have an SUV with a dog in a crate, all at the appropriate social distance. Establish a VCPR just by seeing the pet. You can assess fear, anxiety, and stress, pain, and health by observation. And then finally, we'll talk a little bit about the physical exam and procedures, trying to maintain social distancing and occupational health. So Tammy, anything to add before we get into the actual visit?
No, I think that's a great list, Gary, and I appreciate that you've added the potential to observe some of these dogs at least outdoors, because we certainly do a lot of that for pain assessments. That's what most of mine come in for, and that's really been and I do, by the way, consider pain relief an essential service. So I think that's the whole list is excellent, and I appreciate that you've got that on there as well.
And I think if you look at the second last bullet there, it certainly is practical to do FAS assessment, some pain assessment, some health assessment, and establish a veterinary client-patient relationship by keeping social distance and just observing. Really what we're talking about here is, when is a physical exam or physical contact essential, and how will we do that? So for pre-visit planning, it's really just, once again, establishing through emotional record, medical record, history, and what's needed for the pet, what will be required, first of all, from a telemedicine standpoint, but now we're talking about pets that are going to be coming in, and what they require in the way of products, in the way of drugs, especially since they're going to be separated from their owner. If you must examine them, even at a distance, some pets are going to be 6 feet away from their owners, clamoring to get back, or if you have to admit them to the hospital. And again, planning for health, safety, and welfare for the pet, for the owner, and for your personnel. And once again, fear-free principles still apply and help and can be used. So don't forget the fasting, and don't forget identifying the pet's favorite treats. you might not want to be passing over treats and products from owners to you that have been handled. So you want to identify what those favorite treats are from the emotional record and from your pre-planning, and have them ready from your supply when the people come in. One of the biggest questions we'll have here is whether you are admitting the pet and whether any of their cages, leashes, towels, blankets, toys should be transferred over. And from a health standpoint, human health standpoint, the answer would be no, or to limit those. So favorite treats, identify them and have them available. Products and pheromones still should be used and in place before they come, even more so now because they are going to be separated from their owners at some point. Nutraceuticals, drugs, and I was asked more than once already, what about adjusting the dose? And it's difficult to suggest an adjusted dose because there is a dose range, and that dose range is really human medications in the most part used in animals, as we'll go through that in a moment. And without test dosing, maybe a trial car ride, staying away from people, you're not going to be able to necessarily establish what that dose is unless it's been tested and assessed before. Otherwise, use low to mid-range doses for the pets and adjust based on their health. More sick or ill or unhealthy they are, and Tammy can talk about different levels, the more you want to use the lower ends of the dose range if they haven't been tested before. We can all use pheromones, bandanas, sprays in the crates, in the cars, and of course diffusers in the clinic. And finally, for preparation and travel, make sure the owners have resources. This is the one opportunity to talk to them, to show them things, to display without having any physical contact. So I think fear-free handouts and fear-free happy homes resources are critical here, because they can learn about travel, fear-free travel. They can learn about fear-free into the carrier. Some of it's going to have to be acute and quick, but they should still know the principles, and you should discuss scheduling. So have them read how to make the trip to the veterinary hospital fear-free. I realize not everything will apply because some of them would be practice runs, but certainly they can do a lot of what you can find in resources if you provide them with emails, with links to resources. So fear-free resources, especially many others as well. So products, proper carrier for transferring the pet. And if it does have some visibility through it, maybe the owner has more than one carrier, this may be a time where you use a carrier that has some visual ability to look through the carrier and do some assessment from a distance. So I threw this one up here because you can both inject through the carrier and open from the top, as well as the ability to maybe see the pet through the carrier. But carriers, muzzles if they might be needed, and quickly adapting them to the muzzle. Hopefully they've previously been adapted, wearing their head halters or something maybe to cover the visual stimuli. Natural products. These are all covered nicely in Module 7A. We're really not talking about anything different than we would normally provide. So there are the supplements that you might use. There are maybe music in your car or a talking book playing in your car. You might know that classical music has been shown to help. Recent studies showed that reggae music might help you not worry and be happy on your way over to the clinic too. Excuse the pun, and maybe even a talking book. You could consider catnip or silvervine type products for the cat, maybe aromatherapy for your vehicle in small amounts, pressure wraps, and certainly pheromones. Pheromones that might help with travel, pheromones that might be on a bandana, a collar for examination, pheromones in your clinic in the way of diffusers. And then the PreVisit drugs. And my purpose of this was to say, these are the drugs that we use for PreVisit drugs, described nicely in our drug charts for fear-free, described nicely in our modules. And really, if you've test dosed it or haven't, Ideally, you would want to test these in advance and choose the ones that's most appropriate for the pet. And as I said, these drugs are listed and charted and dosed in the modules. If you're worried about controlled substances, then trazodone certainly might make sense for the cat or the dog prior to travel. And we can discuss these more as questions at the end. Remember, if a single drug hasn't helped, you could try combinations of medicine. Trazodone plus gabapentin would be a combination. Trazodone plus a benzodiazepine might be a combination. So combination products, and you might start 12 hours before if you have enough lead time, and then again prior to the visit. Additional sedation, when it's needed, you add the acepromazine. In other words, that's a sedative for additional, literally sedation on top of something that's going to help with anxiety. So if you don't have enough sedation from the initial products, then you'd add the acepromazine, and these are detailed in Module 7A. Anything you want to add about PreVisit Drugs, Tammy?
No, really nice list there, and I think that's a great comment on trazodone being effective in the dog and the cat if any of the control drugs are concerning in the state that you're in. And I don't know about you, Gary, I still prefer gabapentin in cats, but trazodone absolutely works.
I think as a general, if you haven't tried something before, that gabapentin in cats and trazodone in dogs might be at the top of your list. Dexmedetomidine, I mean, at least these you could potentially send them to the pharmacy to pick up or get delivered before they came. If they don't already have it, the dexmedetomidine, they certainly need to come by the clinic and pick up for dispensing. I just put up a slide to show the fear-free principles and that we're dealing with COVID-19. And I put a check mark beside the ones that we still can apply to make the visit fear-free and to reduce fear, anxiety, stress, and pain. One is read and recognize and respond to the pet's fear, anxiety, stress, and pain, and use the emotional record to support you. The second is to fast and motivate the pet and put the treat in treatment. Considerate approach, which we'll mention in a few minutes, continuing with gentle control, and maybe more so the use of medications. Again, considering not only the travel and visit, but the fact that the secure base and the owner will almost always be absent or separated from the owners. So increased thought about anxiety, analgesia, and sedation, not to mention that the pets you're going to be dealing with are in an emergency or essential situation. On arrival, I guess we have two choices. One is carrier drop-off, which can be done if you've had full communication with the client and maintain communication all the way through from the time you get the pet into your clinic and observe it, or pre-entry curbside assessment, which is just a short form for either observing the pet in the car, in the crate or carrier at a distance, or at sufficient social distance. And you should be able to do some physical health assessment, at least the level of critical needs for the pet, some pain assessment, especially if you're dealing with gait, and you can see the face, visual assessment, and body postures, and of course, FAS assessment. So since this is about reducing fear, anxiety, stress, and pain in COVID times, we can assess these pets from the emotional record and our medical records. We can have the owner assess the pet by giving them the proper resources and letting them see the resources so they can match their pet's signs to good literature, such as these fear-free and fear-free happy homes handouts. But owners are not always great or good about recognizing subtle signs. And this is where FaceTime, some sort of video observation of the pet, or distance observation of the pet can give you the information about fear, anxiety, and stress when they arrive, and whether additional medications or methodologies are needed. And once again, if you have that level of fear, anxiety, and stress or pain, medicate, add medication. I threw in, because I'm involved with research and like the science, I wanted to show you that there is some science to even support some recommendations that we're giving right now, that most of the stress in dogs in this study was even before they enter the clinic. So this is where we can observe them and deal with them. There was one study that compared outdoor examinations versus waiting room examinations. And if you do have the facilities to be able to separate the pet from the owner and then do an outdoor exam, there's less stress outdoors and the heart rate and cortisol were less. There was a study showing that the pet was more likely to play or take treats from the veterinary staff outdoors than indoors if they were stressed. And the stress will be related to some pets, social interactions with strangers, some pets, separation from the owner and the environment. So take all of those into account. When we look at and don't forget the owner's response. There are some owners with their emotional response that will make the pet more stressed. So it's not always more of a problem to remove the pet from the owner, but almost all of the time separating the pets is going to cause more stress. And remember that response could be active, whining, trying to escape, trying to avoid, but don't forget the passive responses, because we do have pets who will start to freeze or inhibit their behaviors. And one study actually looked at separation of older dogs from younger dogs from their owners. And they found when the older dogs were separated, they had less signs of fear, anxiety, and stress, but their cortisol levels were higher than the younger dogs. So you can still have a fair amount of stress, sometimes even more intense stress with passive responses. Similar slide for cats, but they're going to be stressed primarily through travel, but all the way through the veterinary visits. So we want to keep them secure, and we want to deal with them if we have to separate them from their owners with lowering the stress of the environment, social interactions, and separation. So we're going to let Tammy take on the next part, but this is our transition slide where we've assessed that pet. And based on our telecommunication, our video communication, our distance observation, this pet has more pain or anxiety or fear than the drugs have been able to manage, or the no drugs they've been given so far. And this is the point where we want to perhaps add additional oral medications, but the only ones that are going to work fairly quickly are dexmedetomidine oral mucosal gel, or maybe a benzodiazepine for dogs. You can wait about 20, 30, 40 minutes and then do the exam. You could potentially also dispense something if it's not an emergency, so that they can come back in a few hours. So you add on some trazodone or add on some gabapentin or that control drug that you've been holding off with, like a benzodiazepine, ask them to give it and come back later in the day, or even if it can wait till the next day. So there's the oral add-ons. And now we're up to our anesthesia and analgesia specialist, Dr. Grubb, to talk about what more we might be have to do for these more anxious pets. Tammy? Tammy?
Can you hear me now?
Yep, got you.
Okay, sorry, for some reason my microphone goes in and out, but I don't know why or what I do to fix it. So I'm here
so
for now.
Anything more on this slide or next one?
Yeah, let's stick to that one for just a second. So obviously as an anesthesiologist, giving drugs is my answer to everything, but it's really a great fear-free option as well. If we can give calming drugs or even sedating drugs or maybe even anesthesia, then we can obviously release or relieve or even completely eliminate that patient's fear, anxiety, and stress. So we've all had patients that come in, like the one in the picture, that really needs some more medication to relieve their FAS. And especially now that we have the complication of separation from the owner, and that data that Gary just gave was amazing, that really a lot of the stress is just getting into the clinic. It's not separation from the owner, at least in dogs. But we do have some that are quite attached to their owner, or some that we know or predict that might be worse if the owner isn't around. So now we have to add this next level. And there's no reason not to do it. This is, some people, I don't know what happens in your practice, but sometimes we get people that push back and say, well, I don't want to give my pet drugs. And they're really thinking about it incorrectly. These are drugs that are very beneficial and necessary for us to do a good job and do a fear-free job. So just kind of changing their mindset. And I always use the example of a human, and I ask them, if you were really stressed at the doctor's office, so stressed that they couldn't do the work, what do you think would happen? And the answer is you would get an anxiolytic, right? Probably a benzodiazepine. So just thinking about it in a human relation too. So like Gary said, maybe we can just add in another PVP dose. We can double the gabapentin dose, or we could add trazodone to the gabapentin. If they're really painful and that's part of the problem, we might want to dispense an analgesic. But like you said, those often, they're slower. We might have to send the pet home. And I don't know, but I would guess that your practice is a lot like my practice in that it's not always an option for the owner. Maybe it was really difficult to get the dog in the car, even with the medications, or the cat in the carrier. Maybe they live far away. Maybe somebody had to drive them, right? There's a lot of reasons that rescheduling can't always happen. So if we can't reschedule, then we need to go to the next level of treatment. Or maybe this is where we do that visual assessment and we don't need to handle the patient. We can take the good history that we have from the owner and the emotional record and watch that patient moving in the crate or walking around in our parking lot. A quick caveat, we also need to make sure that the patients don't escape in any way, right? So part of fear-free would be good handling, 2 leashes on dogs, things like that. So we might be able to do a visual exam, but we also might need to continue the medication, because here's another reason that we might not want to reschedule. And that is because we are trying to decrease people's exposure to each other to decrease the spread of the COVID virus. So maybe now that they're here, we want them to stay and let's fix the problem. And that's what's happening in our practice a lot. We find ourselves not necessarily increasing the pre-visit pharmaceutical dose. As Gary's already mentioned, we don't know that we need to increase it. So we don't automatically increase it across the board. But we are finding ourselves doing more sedation protocols and even anesthetic protocols so that we can complete the treatments that that pet needs, the diagnostics, the treatments, whatever the essential, right? It would be the essential treatments or diagnostics without that owner having to come back and forth multiple times. So we need to go to the next level then.
I just wanted to make a comment as I'm looking
please.
at your picture on the right there, and I'm thinking of the science of how blood pressure and heart rate often go up in the veterinary clinic compared to home. I certainly know mine do. I have 2 different blood pressures, a home blood pressure and a doctor's blood pressure, which literally needs to be treated if they kept with that rate. But now I'm looking at the dog on the right saying, this isn't theoretical anymore. If the owner can see the picture through visual communication, if you can see the picture, what is the heart rate and blood pressure on the dog on the right there? I mean, this isn't theory anymore. This is fact. That dog is going to be medically unsound if we don't get its blood pressure and heart rate down. So medication is necessary for physical and emotional health. Just wanted to point that out.
I'm so glad you added that. I completely agree. And I think that's another conversation sometimes we need to have with the owner, and that the stress is not just stress, like, oh, the dog's all stressed. Stress is there's a big health impact. So convincing them that the anxiolytics not only are calming the pet, but like you just said, decreasing the heart rate, decreasing the blood pressure, improving GI motility, all of the things that stress, alleviating all of the negative things that stress cause. So yeah, thank you for that. That's a huge comment. And we need to consider that the health of that pet, especially now because we are seeing essential patients and emergency patients. So a higher percentage of our patients that we're seeing right now have some comorbidity. Now, essential or emergency, they don't necessarily have a comorbidity, right? It could be trauma and they're a perfectly healthy patient. But many of them that are coming in are patients with underlying disease. And so I just wanted to remind you of the American Society of Anesthesiologists risk factor chart there on the screen. And of course, this is really what we use to determine risk factor for anesthesia. But since sedation is a prelude to anesthesia, we can use the same chart in this conversation. And really, if we think about it, we're not talking about the ASA 4 and 5 patients in this discussion. They are usually so sick and so incapacitated that they don't need extra sedation. Probably they don't need any sedation. So we're talking more about the ASA 1, 2, or 3. So we might have some concern, but they're not our sickest patients where we're really terrified of any drug that we would give, right? These are patients that can tolerate drugs as long as we give the right drugs. And this chart is in the Module 7 of the Fear-Free certification, and there are a lot of protocols in that module. So if you have forgotten some of the protocols based on ASA status, you could revisit Module 7. So the first thing we want to do, we want to move on then to transmucosal sedation. So the oral sedation wasn't enough, and we can move on to transmucosal sedation. And the reason we're moving to this first is because the owners can often do this in the car, or the cat may be in the carrier in the car, but they can still get to the cat. So as much as we can get that patient calm before we have to separate it from the owner, that's the way we'd like to go. We use a lot of the dexmedetomidine gel, that's the Cilio. And we do usually use it at a higher dose in this situation. That's why I've underlined sedation. We're not using it for noise phobia, which is what it is labeled for. We're using it truly to sedate the patient now, so often at a higher dose. Remember that acepromazine is also absorbed transmucosally. It's a little bit slower than the dexmedetomidine, but certainly is an option. And then if you don't have the Cilio, the injectable dexmedetomidine also works when we give it transmucosally. It's absorbed fairly well transmucosally. And you can see the dosages there. And again, all of these dosages, it's a repeat from Module 7. We just wanted you to have them right here at hand so you didn't have to look them up. You can see that it might be a higher range of dose than you're familiar with or you're comfortable with. But remember two things. One is we're giving it transmucosally, so the absorption is not equal to giving it IM. And some might actually even drip out of the mouth or be swallowed. And it's really the transmucosal uptake that we want. And also, we are dealing with patients who would need a higher sedative dose. So the dose you see there is with those two caveats. Now, the cat range you can see there is pretty consistent what I use. And 0.04 milligrams might be like, she's got to be kidding. But remember, it's actually FDA approved up to that dose, so considered to be a safe dose. The dogs, I put the most common range that I use right there on the slide. But remember with dogs, they actually should be dosed by body surface area. So Gary, if you'll go ahead and go to that next slide. And just remember this is the dexmedetomidine dosing chart. Not only are we dosing these patients on their level of FAS, but also on body size. So if you look in the upper right-hand corner there of that chart, and this is the chart that just comes with your dexmedetomidine, you see that a small breed dog receives a fairly high milligram per kilogram dose. And then if you go all the way to the bottom, you'll see on the right-hand side, you'll see that a giant breed dog would receive a much lower milligram per kilogram dose. So don't forget to take that into account. Don't be afraid to dose that little Chihuahua high, and consider decreasing the dose on a Great Dane. Some people feel like large breed dogs are more sensitive to the adverse effects of anesthesia, but it's really just dosing because we're dosing them by weight and not body size. If transmucosal sedation doesn't work, we might need to consider adding in some anesthetic drugs, and ketamine might be one that everybody has. And we're still talking transmucosal. We're still trying to get this done without wrestling with the patient too much. We want to remember our fear-free principles. And we talked about injectable dexmedetomidine being well absorbed when administered transmucosally. So is ketamine. So we can add some ketamine to the dexmedetomidine that we administered. And this takes 10, 15, even 20 minutes to really get good absorption. So a good thing to just give it to the pet and then let the pet sit for a while. We can also use Telazol. If you have Telazol in your practice, that's the go-to drug for these patients that really need the transmucosal anesthesia or deep sedation. It's very potent and it works rapidly, and it's a small volume, so it's easier to give it transmucosally. With the dexmedetomidine plus the ketamine, I recommend that we try to smear it in some cheese or peanut butter and really smear it around. So all the owner has to do is have that pet lick up the peanut butter or the cheese if they will. And by smearing it around, it's more likely that the uptake is slow, so it's actually transmucosal and they're not swallowing it. If the owner can gently squirt it into their mouth straight from a syringe, then that's fine too. But we may need to go to this level. Now, if we go to this level, and then the next level is even deeper, we want to make sure somebody's observing that pet. Now we need one of our nurses to be out in the parking lot watching that pet in the car or watching through a window, being ready to go and get that pet out of the car as soon as it's ready, or have the owners transfer it to them, whatever it takes to get the pet safely out and still maintain that social distance. We really have to do this today. We may have to truly sedate this patient with injectable drugs and maybe some analgesics. And this is not ideal. This is not what we wanted to do today. But again, we find ourselves having to do this a little bit more often in those pets that are just not yet amenable to handling, and certainly not from separation from the owner. And yet we really want to get the procedure done today so the client doesn't have to be back and forth in public. For the most part, for these patients, we would recommend rescheduling. Go home with gabapentin, go home with trazodone, and come back another day. And we still discuss that with the owner. But again, trying to keep them out of the population, sometimes we proceed. And it seems not as fear-free as we would like it to be to have to get these patients injected, but the fear-free is coming, right? We may have to have a moment of stress to get to fear-free. So this is just kind of the standard, what you would do with these patients. There's nothing different here than what you already know. We give dexmedetomidine plus an opioid, that's often enough, dexmedetomidine plus butorphanol. We might add in a little bit of ketamine or Telazol if it's especially if it's a dangerous animal, like an aggressive animal. And whatever standard doses of ketamine or Telazol that you use is adequate. The other thing we can do is do the dexmedetomidine plus a very low dose of ketamine, just 1 to 2 milligrams per kilogram. We call that ketamine stun because they're not truly anesthetized. So this is I'm going to say worst case scenario. It's not where we want to be, but don't be afraid to do this, to be there, to really get that pet sedate so that we can get it into the hospital and start the essential procedure. Just a few quick case examples just to show you what I'm talking about. Let's start with the dogs because we would be more likely to be adding to the medication while the dog is still in the car if necessary. So that dog in the upper left-hand corner is a dog with mild cardiac disease. It is stabilized on pimabendin, but the dog is in today for a really painful tooth essential procedure because it's not eating. That's a dog, though, that I would prefer not to have to give dexmedetomidine, and I would start with additional PVP, so more gabapentin, more trazodone. And then the dog on the bottom obviously is the complete opposite. That's a dog where we're not going to mess around. We know this dog is most likely going to need injectable drugs, but we want to first start with the oral medications and see how much calming we can get for that patient. The cats, the Siamese kitty, this is actually a cat that we would increase the PreVisit pharmaceutical dose. This cat is pretty good, but he gets extremely nervous without his owner. So there's a cat where I would go ahead and increase the dose of gabapentin before it comes in. And then the cat at the bottom, obviously, again, the polar opposite. Here's a cat where we can squirt the dexmedetomidine and ketamine into the mouth because it is absorbed across the oral mucosal membranes.
So we pretty much covered what drug doses, uses, and applications might be used, most of which are going to be very similar to the protocols that are already in Fear-Free, in the drug charts, in the modules, with modifications that really need to be made based on at least seeing the pet, whether it's video or whether it's directly, so that we can add these additional medications. We do then need to transfer the pet that needs physical exam to the veterinarian, to the staff, in the safest possible way, maintaining social distancing as best as possible. If the pet has been out of a carrier for any reason, you might put it back into the carrier and pass the carrier over, and that could be handled with with gloves, I meant to say. And leash transfer, especially if there might be two leashes, handing one over, or in some cases, there may be an application for clipping the leash and the owner moving away and then taking the leash. But again, safety for the pet and safety for personnel. If the social environment is fear-evoking, you might be able to tell just when the pet is separated from the owner. The 5 or 6 feet away, they may be showing severe fear, anxiety, and stress. So this may be another point after separation where you have to adjust your medication based on how the pet is responding. And then we're into fear-free principles again. You still use considerate approach. You still use your gentle control. We still use our treats, but we try and do everything separate from the owners. So you might get verbal consent or recorded consent. Any resources after the visit, you do a cashless transaction as well as emailing them the resources. And in some cases, it might be worth keeping that FaceTime or whatever video chat you're using on the pet so that the owner can be talked to and see the pet at various times as you have it moved away and admitted into the hospital. I think you'll have to decide, because we're not the preventive health experts when it comes to occupational safety with COVID, but some of the veterinary associations and recommendations are to put on your own leash and put their leash into a bag. And this is one of the most difficult, not to use any of the owner's products, carriers, or blankets, and to transfer your pet to a clinic carrier and either leave that at the door and disinfect their carrier. If you're going to do that, this is where disinfectants that don't have strong odors really help. That's a Canadian brand, Prevail or Rescue, the American product, and pheromones. If you're going to be using your own cage with your own blanket, your own leashes, then getting a bandana onto the pet if it's a dog, spraying the leashes, the blanket that you're going to be using, or maybe it's not even a blanket, it's a disinfectable surface that you've got in your carrier, using pheromones as much as you possibly can to give them that familiarity, especially if they are not having their own leash, their own carrier, their own bedding, their own toys. You'd also have clinic toys and clinic products so that you can provide something that's been disinfected and clean and still give them something that would keep up the enrichment and the positives. So peanut butter in a cup or cream cheese in a cup, giving treats outside in the parking lot. I know some of these are indoor pictures, but they could still apply outside. You could use a rubberized mat, such as the different licky mats, and put it down, and hopefully the pet will come over and lick it, approach it on its own. You could, hopefully with considerate approach, encourage some pets to approach. Again, these are pictures that we have indoors. The assumption would be that these same approaches would be used outdoors. And maybe even for some pets, just attracting them with a little toy to leave the owner so you can keep that social distance. Any pets who have been trained with some considerate approach, with some cooperative care, I should say, might be able to do a sit when they approach you. Certainly the touch commands and the target training can be very, very helpful to see if the pet would voluntarily approach. And finally, when they're in the clinic and in your care, you still may need the standard fear-free principles that are discussed thoroughly in level 7A and 7B on injectable sedation and analgesia. Anything more you wanted to add about this is no longer COVID related, other than the separation. These are our standard fear-free protocols for sedation and analgesia.
Right, absolutely. So go to Module 7 if you have any questions about the protocols. But just as a reminder, don't be afraid to anesthetize these patients if you need to, and especially in the time of COVID, when we're trying to decrease the number of visits that the pet makes to the hospital and decrease the amount that the owner's out in public. So anesthesia, getting the problem solved, right there, that first visit, we're doing that a lot more often so that we can get those pets back home and they can stay home. And then we follow up a lot with video. So FaceTime or just video on the cell phone that they send to us by email, and can monitor the pet in that manner.
So we've included some resources here. They're updated, if not hourly, almost every day. There's good resources on the AVMA website or on the Canadian Veterinary website. This webinar will be available, so you don't have to copy these down. You'll be able to get the links when you look at the webinar later. Remember to contact your state, provincial, or governing body if you're concerned about the need for veterinary client-patient relationship. Obviously, everything we said applies to your existing clients. The question is whether there might be a new client and what your governing body will allow. But I will tell you that the FDA has specifically said, and the link is there, that veterinarians can dispense medications to their clients through telemedicine assessments. So they have relaxed and specifically altered that requirement. Again, your state governing body is, or provincial, is still the authority for regulatory. So the summary is what we said. Provide fear-free care in COVID times. Limit your services to essential and emergency, especially if they're mandated for you, but it's still ideal for staff and occupational health. Plan, assess, and schedule coming in. Use telephone and video communication wherever possible, and keep up the fear-free principles of putting the treat and treatment, gentle control, considerate approach, and medicating. I guess I'm exaggerating when I say early and often, but not really. Remember, it's for the pet, it's for the owners, and it's for the health and safety of the veterinary team. Anything you wanted to add, Tammy?
Just a reminder that, I know you said it a couple of times, but you don't need to automatically increase that pre-visit pharmaceutical dose unless you know the pet does have true separation anxiety without the owner. But you may need to alter your in-clinic or arrival before they get into the clinic protocols by including more drugs at that time once you've seen that.
Exactly, and I will also just say it exact opposite to what Tammy said. Same thing, but in an opposite way. And what I'm getting at is if they do not normally require medication for the trip over, as long as they're with their owners, and you know they have some level of separation distress, then those are pets that you would want to medicate that you might not normally medicate using the standard doses that you see in the modules.
Agreed. And if you don't know, then certainly getting them where you can see them in the parking lot is a great way to make a decision.
So I think that's our last slide, and if Jessica's there to handle things, she can tell us how we can manage any questions. I know we've spent extra time, but I think most of us, except for those who are actively in practice today, have some social isolation time to be able to get some education, and we wanted to make sure we were as complete as we could on our topic, but there'll be many more resources available for fear-free as the days go on and through other sites. Jessica?
Awesome. Thank you so much, Dr. Landsberg and Dr. Grubb. We had one question come through for our brief Q&A session. And the question is, in case a dog or cat is anxious and the PVP dose does not have the desired effect, is there a problem to add dexmedetomidine, for example, with gabapentin or trazodone?
That's a great question. And I'm sorry, Gary, I've talked right over the top of you, but I get this one all the time. So if you don't mind, I'll answer this one.
Yeah.
No, the answer is no. And in fact, often we have to do that, and especially if sedation or anesthesia is the goal, then absolutely we should be doing that. My recommendation to you is to look at the pet and see how calm or how sedate it got from the pre-visit pharmaceutical, and alter your dexmedetomidine dose accordingly. If it didn't get calm at all or not sedate at all, then I'm not decreasing my dexmedetomidine dose at all. If it's more manageable, but still I can't get the job done, I'll give half my dexmedetomidine dose. If it's really calm, but still I need some sedative, then I'll give a quarter of my dexmedetomidine dose, so my standard dose. So a quarter, a half, or a whole. And then the great thing about dexmedetomidine is it's reversible. So at the end, when you're completely done, you can reverse it if that's the right choice for that pet.
Exactly. I would give two precautions. One precaution is related to the use of clonidine. Clonidine is also an alpha-2 agonist. So maybe if you've used clonidine, you might want to be a little more cautious when adding on dexmedetomidine. Of course, if it hasn't worked, then some additional might be warranted. Or maybe clonidine would be avoided and you'd use one of the other medications before they come in so that you can save the dexmedetomidine for the visit. The second one is just a reminder that if a pet does have separation anxiety or is currently on an SSRI or a drug that might increase serotonin, that you have to start your trazodone, which is the one drug that may increase serotonin as well, at the lower end of the dose rather than the higher end. So only two precautions are dexmedetomidine with clonidine and trazodone with dogs who are already on drugs with serotonin increasing. Other precautions apply to the medications, of course, based on health and label.
Great, thank you. The next question is, what are your thoughts on using melatonin for sedation?
I think that when we're dealing with a pet that is fearful and anxious, that you're not going to get significant effect with melatonin, sometimes none. I don't know that other than as an add-on product or giving to a pet who possibly might not need medication, that I would use melatonin as my first choice. I think it's a good add-on drug. I think it's potential for a nutraceutical for reducing fear, anxiety, and stress. But regardless of whether you use melatonin or not, when you assess that pet when it comes to the veterinary clinic, then the add-on medications are necessary. So personally, I think that this is not a place where melatonin or even some of the other nutraceuticals alone are going to be useful, except for pets that have no or extremely mild fear, anxiety, and stress based on emotional record and previous history.
Great, thank you. And our final question is, do you have any recommendations for mobile house call visits? We are trying to figure out how to continue seeing our cat patients but not enter the home, using medications and social distancing if possible. Dogs, we already have a better idea on how to do this.
That requires a little bit of thinking. Tammy, do you want to start with that? Well, obviously, the pre-visit medications still apply exactly the same. You know you're coming to their home and you want them to give the pre-visit medications just as if they might be coming to the clinic or might be examined in the veterinary clinic. So from a pre-visit medication alone, consider using the same drugs that you would under normal circumstances. Plus, if you're a house call veterinarian and you've seen the pet already, then you do have a history, emotional record and health history of what the pet has had in the past. So it partially depends on whether this is the first time you're seeing the pet or not, because you will have a history from previous visits. Tammy, do you have something to add there?
Yeah, just a little bit. The mobile house call, great question. Actually, the pre-visit pharmaceuticals are a bit easier because we often arrive and see, we can see the dog or cat maybe calmer in their household, but we say, okay, we're not going to be able to do much. So we can leave then the gabapentin or the trazodone, go do a few more calls and come back then in a few hours. So it's been kind of nice. It's sort of a drop-off service, but we charge for it as part of the exam. So we are definitely still using those pharmaceuticals. You guys are right. We're trying to do the dogs more outside. Cats are definitely a little bit more difficult. So here's some of the things I've done. I've actually watched cats through the window if there's really no way that that they can get the cat out or I can get in the house. I've had them put cats in like larger, like crate kind of kennels where they can put them outside and then I can observe the cat. I don't take the cats out ever. So if I can get an exam through those crates, I do. Or if they have any kind of screened in porch, anything where there's more ventilation, then I'll go in and examine the cats that way. But I agree, they're harder. And so we still have more of the cats come in than the dogs. Just for the cat safety, I would be devastated if one of those cats got free.
Yeah, I think that the social environment, the health risk in that environment needs to be thoroughly assessed, because you do have the choice of, if you must physically contact the cat, either having the owners leave it in the carrier and completely distancing themselves and going in with appropriate protective clothing. You have the option of doing it in a semi-enclosed outdoor location, such as a garage, such as a lanai, or even perhaps your vehicle. And you have the option of taking it back to the clinic if it really is the only way to examine it. So I think there's the two parts. There's the observation and getting the right medications in advance. And number two, there's the physical part of it that requires the additional safety of COVID. And there's some options there as how you might do it.
Right. And, that's a good point. We end up bringing, when I said the cat has to come to the clinic, yeah, I wasn't very clear. We bring them back with us if we're out there doing the mobile work. And we actually had that service before. We have lots of elderly patient or clients, people who don't drive. So we pick their pets up a lot with sort of a little ambulance service, if you will. So Gary's right. That's a good way to pick them up and take them back to the clinic where we have a more controlled environment. Jessica, may I answer that last question there, because it's a follow-up on a question we answered before?
Yes, of course.
Great. Louise, yes, the answer is absolutely. So if you have given a cat the gabapentin and it had no effect, definitely give the dexmedetomidine for sure. I do it all the time. And again, it may prolong recovery. You have to get the cat sedate enough to work with it, right? So we have to work up front first. Up front, we got to get that cat sedate. It might prolong recovery, and then again, that's when you could decide whether to reverse the dexmedetomidine or not.
And when it comes to dexmedetomidine oral mucosal in cats, the gel is very hard to dose. So if we weren't clear, if there's an indication for dexmedetomidine as an oral mucosal in cats, you would want to take your injectable and provide the owners with a syringe with it, or maybe even with a little maple syrup or honey or something that would make it a little bit more tacky or sticky. I don't think the Cilio gel, at least in the format it's in right now, is going to be practical for most cats.
Great. Thank you so much, Dr. Grubb and Dr. Landsberg, and thank you everyone for joining the webinar today. You'll be able to find the recording of this webinar on fearfreepets.com within the next week. Thanks again and have a great day.
Thank you.
Thank you.